Welcome to your complete guide on the AMC MCQ examination, rules, process and preparation. If you're an international medical graduate planning to practice in Australia, this video is designed specially for you. By the end, you'll understand the exam structure, rules and strategies to prepare effectively, so you can take the big step with confidence. Let's start by understanding exactly what AMC examination is all about. The Australian Medical Council examination is a crucial step for international medical graduates, often called IMGs. Why? Because not every medical degree from around the world is directly recognized by the Australian Medical Board. The AMC process ensures that doctors entering Australia meet the local medical standards. It happens in two stages. Stage 1, the MCQ examination, a theory-based test, and Stage 2, the clinical examination, where your practical and communication skill are assessed. And here's the key, the MCQ exam is your first major hurdle. Without it, you cannot progress further. So now that we know what AMC exam is, let's dive into the structure of the MCQ exam itself. The MCQ exam is a computer-administrated test with 150 multiple choice questions with a duration of 3.5 hours. But what makes it different is the Computer Adaptive Test Format or CAT. Here's how it works. If you answer a question correctly, the next one will be harder, and if you get it wrong, the next one will be easier. This means every candidate gets a unique exam tailored to their performance. And the benefit, the system quickly and precisely identifies the actual ability level, much more effective than the traditional fixed length exam. Now that you understand the structure, let's see how the exam content is distributed. The 150 multiple choice questions aren't random. They are spread across 6 important patient groups: adult health medicine 30%, adult health surgery 20%, women health OBGYN 12.5%, child health 12.5%, mental health 12.5%, population health and ethics 12.5%. This ensures you're tested across a wide variety of medical disciplines, not just one specialty. So to prepare well, you'll need a balanced study approach that touches every category. But it's not only about subject areas. The AMC also tests specific clinical skills within those subjects. In the exam, your knowledge is tested through 3 main tasks: data gathering, your ability to take histories, perform examination and order investigation; data interpretation and synthesis, clinical reasoning, problem solving and identifying key issues; and management, planning treatments, intervention and educating patients. The AMC wants to see if you can function as a safe doctor ready to treat patients in Australia, which brings us to the next big question. What's the actual level of difficulty you should expect? The AMC MCQ is set at the level of a final year Australian medical student who's about to begin internship. So what does that mean for you? You'll need to understand pathogenesis, how disease develop, clinical features, signs and symptoms, investigations, what tests to order and interpret, differential diagnosis, thinking beyond the obvious, management and treatment, safe and effective care. But remember, this is not just about memorization. The exam focuses heavily on reasoning and judgment. Okay, so now you know the level, but how do you actually register and schedule this exam? Registering is simple, but there are steps you must follow. Log into the AMC candidate portal and set up your AMC portfolio. Once reviewed, you'll receive an eligibility authorization. With that, you can book your exam through the Person Views system. Exams are held year-round, just not in the months of January and December, both in Australia and overseas test centers. A quick tip: seats are allocated on first come first served basis, so book your spot as soon as you're eligible. Great, now you're registered, but what happens on the actual exam day? Let's walk you through the experience step by step. On the exam day, here's what you should expect. Arrive early. Late candidates may not be allowed in. Bring 2 IDs, primary, passport or government ID with photo and signature, secondary bank card, driver license, etc. Store all your personal belongings in lockers, no phone, watches, wallets or notes allowed. You'll be given an erasable noteboard and marker. During the exam, stay in your assignment seat, answer each question before moving forward. You cannot go back to previous questions. Once finished, raise your hand, return your material and your exam is complete. Now you must be wondering, how exactly is this exam scored and when do you get your results? Unlike traditional exams, your score isn't just the number of correct answers, because it's adaptive. The exam looks at your ability level. 2 candidates may answer the same number of questions correctly but get different scores depending on how difficult their questions were. Your results are published on your candidate portal. Release time is 9 AM Thursday, 4 weeks after your exam day. So patience is key, but the system is fair. And that's it for the video, guys. I hope you liked it and found it informative. And if you did, please press that like button and subscribe to our channel for more such content ahead. If you have any doubt regarding the AMC MCQ exam, please list them on the comments below. We'll be very happy to answer that. I'll be seeing you in the next one. Till then, bye bye.